Hello guys, welcome back to my channel Ages Kingdom, and in this class I would like to continue with growth and development. That is factors influencing growth and development for every child, because when you see group of children, one child will be chubby and one child will be very thin, one child will be in moderate body structure, and one child will be very active and one child is very dull. So means each and every individual is unique in their growth and development. So, for their unique growth and development, what are the actual factors influences their growth and development? That is what I am going to discuss in this class. So, we will see what are the factors influencing growth and development. So, growth and development is completely depend on multiple factors, and they influence directly or indirectly by promoting or hindering the process of growth and development. It's a very clear definition they mention. See, it is influencing. One second. So, it is directly or indirectly influencing the growth and development of an individual. That is what you have to accept compulsory. So, suppose I am here, I'm talking, I'm taking class, I'm a nurse and I'm taking class, and the same thing. So many nurses are there, but some nurses can able to teach, some nurses cannot able to teach. Some nurses can do service very well, but some nurses cannot do it. So in these differences, when you see, so each individual is different. So that means for my growth and development, factors are different. For other people, growth and some factors are different. So that is what I am going to discuss in this class. So first and foremost, very important factor for each and every individual growth and development is first one, genetic factors. It is a very important question, several times asked question. Okay, define growth and development, write the principles of growth and development, and write the our classification of growth and development. This is a repeatedly asked question, so make it as a classification properly. So genetic factors, prenatal factors, and postnatal factors. So overall we are classifying growth and development total factors into genetic factors, prenatal factors, and postnatal factors. Genetic factors, everybody knows that our body physique, color, including eyes, hair color, everything is completely based on our genetic factors. It can be from forefathers or from our parents or even from our cousins. So even the genetics will be carried from one generation to another generation. So now my color is carried from my father, and my physique is completely carried from my father, and some of my qualities like developments are from my mother's side. That means so many factors from the genetical side will carry from one generation to another generation. So first important factor for your growth and development is genetic factor. So if your father or if your mother is a very short structure, dwarfism, definitely your growth will be according to your parents or your foreparents generation only, because it is influenced by your genetics, your parents genetics. So growth, how much you give food, everything also, you will not become taller because your genetic factors are like that. Your parents may be in dwarfism. Okay, and prenatal factors, prenatal or antenatal factors. I strongly believe that antenatal factors will influence the growth and development of an individual. How means, if mother is taking healthy food, baby born with 4 kgs of weight. I have seen literally some of my friends, kids. And if mother is having several pregnancies and several abortions, already mother is anemic and she don't have enough nutrition, very poor family, all the things will affect even the baby also. Baby born with small size, preterm baby or premature baby or low birth weight baby. That means baby growth and development was influenced by prenatal or antenatal factors. It is a very important thing you need to remember. Okay, that's fine. But mother has given good nutrition, baby born very healthy way. That's fine. After birth of the baby, what kind of factors are influencing for their growth and development? Their economical status, their environment, and parents' educational status, the number of children, or maybe she has affected with some health issues, or maybe some injuries happened, or due to some vaccine some reactions are there. These all factors also influence the growth and development of a child. Very simple example I'll tell you. Prenatally, she is very healthy and she gave birth to a healthy baby. But after that, suddenly baby fall down from the bed or cradle from highest level to lowest level. Suddenly injury happened to the brain. So one area of the brain will be clotted and it is causing some disaster changes. So what will happen? These things can lead to cerebral palsy. Now her growth and development is completely influenced by the postnatal factors only. Completely influenced by the postnatal factors. So these are the three factors we are going to discuss in this class. So each and every one factor we will discuss now. That is genetic factors. So best examples, genetic predisposition is the importance factor which influence the growth and development of children. Already explained, like sex, race and nationality. Best examples we can see all Manipuris looks like same color and all Manipuris hair is same. So such things cannot be changed and it carries from generations to generations. So sex, race and nationality. And when it comes to the prenatal factors, intrauterine means when baby is inside the womb, what are the factors influences for baby growth and development? I'm speaking not about mother. What are the factors will influence growth and development of a baby? I strongly believe maternal malnutrition. If mother itself is a malnourished and mother itself is a anemic, definitely child will not get a good nutrition and child will not be in good hemoglobin and other nutrients. So definitely child may born with malnutrition and maternal infection. So here I want to use the word torch, TORCHS. Any infections to the mother definitely affects the baby's growth and development. Torch, TORCH. T means toxoplasmosis. O means other infections like HIV and tuberculosis. R means rubella. C means cytomegalovirus. H means herpes simplex and herpes zoster. So if these all are viral infections which can carry from mother to baby, through placenta. So if mother is having these torch infections, infections can spread mother to baby and can cause some congenital abnormalities in the baby and causes delay in growth and development. And maternal substances, if mother is already alcoholic and drug user or heavy smoker, that also definitely affects the growth and development of the baby. And any maternal illnesses like mother is having asthma, diabetes, then hypertension, these conditions also will affect the growth and development of the baby. And hormones, definitely hormones will affect the growth and development of the baby. Like if hormones are excreted more, that can leads to hypothyroidism of the mother can affect the baby for growing of certain teeth at the time of birth itself. And some of the miscellaneous factors also, like mother is low socioeconomic and multiple pregnancies are there and repeated abortions are there. These all things also can affect intrauterine factors. Next one is postnatal factors. After birth of the baby, what factors causing growth and development? Delay in growth and development means that is nutrition, any childhood illnesses like communicable diseases or non-communicable diseases, um, any physical environment like extreme cold or extreme hot, and psychological environment if parents are not giving a proper love and affection and care, even that also can affect the changes in growth and development. And cultural influences, definitely cultural influences affects the growth and development of the baby. And socio-economic status, then climate and season, play and exercises, and birth order of the child, intelligence and hormonal influence. These are the important factors influences growth and development of the baby. And socioeconomic status is the strongest factor because India is a developing country which is causing a lot of nutritional problems in children. So most of the growth and development is delayed due to socioeconomic status only. And any childhood illnesses, either communicable or non-communicable disease, physical environment, either it is extreme cold or extreme hot, also can affect the growth and development of the baby. Psychological environment means if parents are divorced, single parent or adopted child or neglected child or abused child, these factors also can affect postnatal growth and development of the baby. And cultural influences, like they should not eat this thing, that thing, or that things also can affects growth and development of the baby. And play and exercises, those who have a good play and exercises, their growth and development is very high compared to other children of the same age. So that means because they develop a lot of new things, IQ levels will be high compared to other people. And birth order of the child also definitely affects the growth and development of, because first child will get a more priority and more importance compared to the last born child. So birth order and intelligence, their and IQ levels also affects growth and development. And hormonal influences, if hormonal influence means if baby is having a growth hormone very high, then it can leads to gigantism, and if it is low it can leads to dwarfism. So these kind of factors we can see in postnatal factors. So overall, total factors influenced for the growth and development of the child is genetic factors, antenatal factors or prenatal factors, and postnatal factors. So these are the things, and it is very important. Please classify and write the total classification, and definitely will get a good score. So it is asked for 10 marks and several times asked question. And if you really like my videos, please do subscribe and share. Thank you.